my gosh. Extreme trash truck nightmares, ultimate wind chime warnings, and plenty of other new fears unlocked. Today, we're breaking down and reacting to all of the disastrous medical scenes and ill-fated injuries from Final Destination Bloodlines. Let's dive right in. Oh no, of course.
Of course.
In emergency medicine and in trauma medicine, anytime you fall from greater than 3 times your own height, you always want to consider worst case scenarios. It doesn't mean that you're ultimately going to have really bad outcomes. It just means that the index of suspicion needs to be high. One small piece. Oh. Shards of glass can also get embedded in the hand or the tissue. We'll get an x-ray of somebody to see if there's actually any pieces of glass still in somebody's tissue. If there is, we got to go find it and try to get it out of there. Sometimes we can't, and you'd actually have to have a continuous x-ray done, trying to navigate the tissue to get it out of there. Whew. What? This movie is disastrous. At least we got some anatomy where we're seeing things we normally wouldn't see. In real life, there's a lot of the red stuff around and it coats things so you can't see it. When we have somebody who comes into the emergency department with bad traumas and a lot of bleeding, you can't see things really well, so we have to get the bleeding to stop. Oh gosh, the crunch noise, probably a distal tib-fib fracture. People break this often. It's near the ankle, makes up part of the ankle joint itself. There's multiple bones that make up the ankle joint. Oh gosh. Impaled through the posterior part of their skull or the high up part of the neck going through. The amount of blood coming through could potentially happen. This is basically through somebody's brain stem in the back. The brain stem has to do with your autonomic nervous system and your functions, so it's not compatible with life. Got all the other person's blood in their face, in their mouth, in their eyes, definitely transmitting whatever potential pathogen is in the blood into that individual. You're thinking hepatitis B, hepatitis C, HIV. Those are the big viral ones that you worry about. Oh, glass right into someone's foot. Oh gosh. We get x-rays, we'll see the glass. We want to make sure that there's no broken bone. If it's going through your shoes, you got to cover for different types of bacteria. Depends on if it's a foam shoe versus a normal sneaker versus barefoot. You need different types of medication. And then puncture wounds, you need to close up or have it slightly open to allow drainage. It's okay. It's all right. Lawnmower blade to somebody's face. A lot of soft tissue injury. How would somebody pass away from this injury? It would have to go deep enough to cause the destruction of the brain tissue and interfere with the airway itself. Oh my gosh. Just rip it out. Just rip it out. You're screwed. Just rip it out. Well, now you're on fire. When somebody does come to the ER with burns, we want to make sure heart rate and blood pressure are all normal. We also want to make sure that their airway is intact. If there's concern that the airway might get occluded soon because of swelling or melting of the airway, we'll do an early intubation to make sure that we're protecting them. Oh. Yep. Nope. I mean, what? How much body surface area did you get burned? What areas of the body did you get burned? And lack of oxygen, smoke inhalation, altered mental status from the chemicals that are being burned, or you've burned your airway so badly that it's melted away and you can't get any oxygen in.
No one gives a shit about your stupid little death curse, okay? So take a hint and leave us alone.
Oh gosh.
We're not coming for our family.
Oh my gosh. Oh, it's a compactor. Oh my gosh. That is so scary. What? What? slow compressive force crushing the jaw, skull, and the rest of the body. Most of the time, jaw fractures we end up seeing from somebody getting punched in the face. Fracture might happen over here, and then you see another one on the other side or in the middle because the energy has to come out. They did a good job of like skull fractures open. You're gonna have bleeding because of the tissue ripping open.
That's really good. You gotta be kidding me. You're telling me you're not allergic anymore?
I don't know, man.
That's just perfect, isn't it?
Maybe I grew out of it.
When somebody has an allergic reaction, the first thing we always think about is the hives that we're getting. What also will happen is you'll have swelling of tissue where you feel like your throat is closing because you're having swelling of the tissue of the tongue. And then your blood vessels are vasodilating, so your blood is going out to the periphery, your blood pressure is dropping.
Hey, you're doing it. Yeah, you're doing it. Bobby, you're doing it. I can't give you that. Okay?
Emergent treatment is epinephrine, adrenaline, that EpiPen. You just slam it into your tissue somewhere, get it in your body. Sometimes you have to have multiple doses of it. It's really good to make sure that you have a 2-pack of your EpiPen with refills.
Bobby, hey.
Wait, what? Watching these treacherous injuries reminds me that sometimes life's occasional stresses can hit just as fast. That's where Chillax by my company Life Happens could help ease the tension and bring on those calm vibes. Check it out at lifehappens.com or Amazon. What the heck? Oh! Oof. Oh my gosh. Come on. I think this is called the Prince Albert. I think. Bend backwards like that. Is there enough force to be able to do that? I don't know.
I don't know.
Wow. He's got a lot of facial swelling. We do see that people's faces will swell, but he got the epinephrine in there, so hopefully it starts kicking in pretty fast. It usually works pretty fast. You'll start feeling tachycardic, a little jittery, but that is normal.
You okay?
Keep moving, keep moving. These things weigh a lot. If they hit somebody, they're going to crush you. These cases don't come to the emergency department because they're DOA, basically. They're pronounced on scene. I believe in an earlier Final Destination, there was an issue with big trees on the highway. Final Destination, holy cow. Let me know who's seen it. How'd you like it compared to the other movies? This was really intense, and I like almost feel bad for the characters. Like, I have sympathy for them and compassion for them that, like, just bad outcomes are going to occur. But if you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.